Welcome to COIQ, a first of its kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxy, founder of Legacy DNA Marketing Group, and it's time to raise our COIQ. Welcome back, COIQ listeners. On today's show, we have with us Dr. Ashish Atreja, and he is the Chief Innovation Officer for Mount Sinai, the founder of the Sinai App Lab, and the founder, you know what? He's founded so many different businesses and he's got his hands into so many different things. I'm just going to hand it over to him. Welcome to the show, Dr. Atreja. Go for it. Tell us a little bit about your background and what you do.
Thank you. Thank you. I would say I will start by saying that my wife calls me 20% doctor because I practice 20% of my time. Rest of the time, I'm very lucky to spend in innovation. So as a chief innovation officer in medicine at Mount Sinai, I lead innovation, especially in digital health technologies. And I've been a physician informaticist for the last 20 years. After my residency, I got informatics training, board certified. But last 6 years is completely focused not on core informatics, EHR informatics, but actually building new technologies with data scientists, with app designers, with UX UI, completely new field, what we call as digital medicine. And I think that has even bigger potential to transform healthcare than what EHRs did, for the last 20 years. So our apps are now in 15 countries. We have done projects from cancer care to heart care to GI care. And 3 years ago, I think bulk of our focus, which is right now, is we call it a fit journey. We moved from innovation alone to transformation, where how do we put all the different innovation that's happening, all the different startups, all the different apps, but making it much more cohesive and much more structured so a health system can unify that and allow it to be transformed.
I work with a lot of health innovators who are, having different amounts of success with penetrating the market. And so kudos to you for having your technology in 15 different countries. So, what's the secret? Is it the brand name of Mount Sinai behind you? Is it something else? Is it the technology? Help us understand how you've been so successful.
Yeah, I think our journey is continuing. I wouldn't call it's super successful. It's just, we just enjoy every single day and build technologies. I think everyone says that, but I think the reality is technology is a part of it. And it's not just one person, it's a team, right? Which enables that. And it becomes robust over a period of time. But also I think it's a collaboration because I haven't gone to 16 different countries, right? But because of collaborations, the partners are able to take things further. So I think learning about what technology can do, building new things which have not been there before, creating a unique value, and then driving down and finding partners which can extend that value and disseminate the value and transform that value is kind of the core strategy part which I'm involved in. Without that, you can't scale things. Of course, technology has to be scalable, but there are many technologies which are scalable, which don't get scaled because we don't find meaningful partnerships, collaborations to make things happen.
Absolutely. Collaboration is definitely key. Do you find that these partnership alliances are coming to you, or are you going out and seeking the best ones that are a fit for what you're looking for?
That's a great question. I think when we started off, it was mostly we looking out to say what's out there because we want to learn from the wider landscape and see what is missing, which health systems need to do as well, right? Within Mount Sinai, within our app lab, we don't build anything that's been built before. We try to build new things, so we want to have a very good external landscape view in that regard. As we have grown, and I think we have also started seeing people or technologies, actually, or startups reaching out to us directly. And they are saying, hey, you're doing this, you have a platform approach at Mount Sinai and multiple other health systems, which you can prescribe apps and you can connect all those apps together. What do you think of this app we are building in this space? And this is pretty novel. So I think, that is actually a very exciting part where it creates an efficiency which was not there before. It's inefficient to go out and find the right things. but it's more efficient if people come to you. So I think we're lucky to have that kind of a model evolving in that regard.
So, do you have more success uh, penetrating your innovations within the Mount Sinai hospital system that you work in, or do you have more success commercializing it outside of the system?
That's a terrific question.
Both are inherent. Both have their own inherent challenges.
That is absolutely true, right? And it's very easy to say, hey, you're within a health system and you're building technologies. You're probably every person in that health system patient is using your technology. But nothing is farther than truth,
Mm-hmm.
right? So I think what happens is health systems have more challenges adopting technology which are inherent to how they're structured. And
Mm-hmm.
that is irrespective of technologies within that health system or coming from outside. Those structural challenges remain. And I'll give a very simple example. And I'm a gastroenterologist, so I talk about shit all the time. So if you allow me, I can talk about an example from
Yes.
that. Um, so the platform we built to coalesce all the technology, unify all this technology, got spinned off into a commercial entity called as Rx.Health, which is a Mount Sinai spin-off.
Mm-hmm.
And Rx.Health had built more things on top of the platform, and they built how they can stitch different technologies together called Rx Stitch. And then one small facility in Arizona reached out to them to say, hey, we have such a big problem with colonoscopy patients because we have 1 in 4 colonoscopy patients who have poor bowel prep. And we give them a paper, and 1 in 4 people forget the paper where they've kept. And 1 in 4 by the Rx Health worked with them to create an engine completely like a bot engine for peri-procedural pericolonoscopy. That became super hit when they measured. They were able to reduce the aborted procedures by half. 92% patients wanted to, use it for next procedures. That American Gastroenterology Association, our national association, actually now partnered with the Rx Health to make it nationally available as a
Whoa.
best practice.
Mm-hmm.
Now Mount Sinai is now coming up and saying this is a cool thing. We need to do that, and now we're bringing it to Mount Sinai. So sometimes I think you bring it externally, and and also as a spin-off entity, they can grow much more faster than we can grow internally, right? But they are able to find use cases, and sometimes we learn from them and bring back those use cases. So
Sure.
just an example how it can come, how diffusion of innovation can spread, not only inside out but outside in.
So there are so many health innovators that are out there right now in the trenches with just incredible innovations that solve challenges that are like our most pressing issues, and they're overall, I hear that they're really struggling to kind of get in front of the key decision makers, and to be able to even have a chance to pitch their innovation. And even when they do get in, the inherent challenges and barriers to the structure, do you have any recommendations for our audience, some best practices, some strategies for having success with being able to sell to a hospital system?
Yeah, there's a famous saying out there: if you want to go fast, go alone. If you want to go far, go
Mm-hmm.
together. So I think I've seen many startups who struggle with getting key ecosystem, kind of partners and the key thinkers for decision maker, um, are just solo scientists. They may not have a
Mm-hmm.
physician in the team. They may not have any care person. So they are completely have an outside lens. Um, but I think my main recommendations to them is get some, thought leaders, get some patients also, get
Mm-hmm.
patients, get physicians, get researchers as advisors, as consultants, as whatever you can, create a role for medical role. That way you have a knowledge because it's not about they can't get into a decision maker. It's very tough to know who the decision maker is,
Yes.
right? And
Mm-hmm.
someone who partners with them, who is part of the health system, can say, hey, what you're building is actually more for quality, and this is inpatient quality, so chief medical officer will be the right person. You don't need to go to CIO for that, or
Right.
CEO for sure. You don't need to go to CEO for that, and never a CFO for that, right?
Sure.
So, right, and this thing which you are building is actually for population health. You need to find who is managing the population health in this place, right? So I think So if you get into the front of the right person, then it's much more likely things will either be yes or no, but the decision
Mm-hmm.
making will be faster. But a lot of the time, the challenge is we touch someone at the periphery, and that person takes its own sweet time, then introduce to some other person, and you kind of have this game that's getting played. And not because of anyone is insincere, it's just that it's incredibly complex to navigate. But if
Sure.
you have a person who's navigated a path before, it just makes it much more easier.
Yeah, it's interesting. So, when you think about selling, there's all of these different types of decision makers, right? The gatekeeper, the decision maker, the influencer. And I recommend that clients find their Trojan horse. And so this is someone that's in the organization that has no influence. They're not the gatekeeper. They're definitely not the decision maker, but they are the ones that know everything that's going on, right? They're the ones that can pick up the phone and call you and tell you your competitor just walked in. You need to get back in here. So I think everybody needs to have a Trojan horse too.
That's a great idea. I've never thought of that, but I can see that can potentially work. You need people who vouch for you, advocate for you, who believe in
Hmm.
you.
Sure.
Whether it's Trojan horse or not, they may just do it in a good spirit because they really trust you and the value you,
Right. Yep.
and have taken time to do that. Because many times decision makers don't even have time
Hmm.
to find the trust.
Sure.
But I think that someone who trusts and believes in you is super important.
So, what innovations, and maybe it's the Rx.Health, but what innovations have you successfully commercialized outside of Mount Sinai?
Mhm. So my journey started in Cleveland Clinic. So where my first thing, which was actually most of what I do is actually based on problem centric approach. What is the
Hmm.
problem that's happening rather than solution centric? What we can build. So
Yep.
I got a page from higher up in Cleveland Clinic, but I never received that page. This is 2005, 2006, because I was 100 miles, 200 miles away from Cleveland. So then I realized that pagers are, not at all foolproof. Like the batteries go die and you lose the pager message. So we created the first web-based paging system
Mm.
at Cleveland Clinic, where it will archive all the pager message. You can automatically forward to someone else if you're going outside. That became so super successful. It's still actually used across Cleveland Clinic Health System
No
by the name of My
kidding.
Paging. Yeah, it's just phenomenal. Um,
That's
I had tears
awesome.
in my eyes when I went there for grand runs and I saw that being used. So this was like way back technology, but this was one of the first ones, and that got licensed out to American Messaging, the second biggest pager company in US. So I had some experience before I came to Sinai, and at Sinai, I think when we built this platform to prescribe apps connected with EMR, we started getting so much requests from other health systems and other payers as well. And within Sinai, we couldn't support other health systems. We don't have a team big enough to actually go and support and do integration and all those.
Sure.
So it was very natural. Our Mount Sinai innovation partners, our tech transfer team, helped create a spin-off called as Rx.Health. So we licensed this platform to prescribe apps and digital care pathways.
Hmm.
At that time, this is around 2 years ago. But we
Yep.
also licensed out technology for remote monitoring, um, uh, so patients can keep track how they are doing, and that was plugged on top of the platform as well.
Hmm.
Um, since then, RX Health has built so much things on top of it. They built a stitch engine where they can connect digital rules together, and they have a whole clinical team which is making clinical rules around every perioperative care, around radiology, and they have partnership with American College of Cardiology to create a cardiovascular toolkit, and with AGA for GI toolkit. And one of the key things they are finding is there's so much need for information before and after procedures, and those are very expensive procedures. So, for example, radiology alone, there's a 10% no-show rate for average radiology procedure. Colonoscopy, 1 in 4 patients, sometimes have poor bowel prep. So, if we provide them information at the right time, doesn't have to be downloaded app. It could be a bot. It could be
Hmm.
a voice kind of a thing, voice rules. But if you get them through that journey with a need-based journey, you can suddenly make the whole healthcare much more efficient,
Hmm.
and it can lead to immediate ROI within the same 3 months period. So I think part of our learning has been
we are able to find not just where routinely you can create revenue ROI for a hospital, which everyone can, complex disease and pop health, but
Sure.
actually things which are so mundane, people don't even think you can create value. Uh, but then you look at 100 use cases you can create. It's just healthcare is such an interesting field where if you just are bent upon creating efficiency, you will find thousand ways to create efficiency, and even CFO would never have thought of that. That is possible.
So we talk a lot about messaging with clients and on the show, and everybody kind of has a different perspective. Some folks are like, you've got to have the ROI story. Some other folks are like, there's a real problem, and it's a little bit more of the altruistic goals of like patient care, and then you've got efficiencies. In your experience, is it what's really important for the messaging strategy? Is it all of those? Is it one in particular?
Yeah. So I think the reality is health systems are really starved of finances.
Mm-hmm.
The margin has really decreased.
Yeah.
If you walk in and share just patient experience of such clinical journey without tangible financial success story,
Mm-hmm.
uh, it's tough to find someone who will just bet on that.
Yep.
People want that, but they wouldn't be able to create resource for that. So
Mm-hmm.
ultimately, it cannot go very far. So a lot of stuff we do is we bucket into clinical success and financial success. In some
Mm-hmm.
cases, operational success. And for us, it's not either or.
Yep.
It's where we can hit all the three bubbles up on the top of the priority.
Mm-hmm. Yeah, that makes sense. So you and I have already talked a little bit in the past about this notion of, clinical evidence that the health innovators, have to have in order to have any chance of commercialization. And I know that you've done quite a bit of work in this space. So just kind of talk about what that journey was like for you, and in creating resources to kind of help innovators develop the evidence that they need.
Right. So I think one of the things is time intensive, right? Something that startups don't necessarily love.
Yep.
But I think healthcare startups are and need to be different than, you know, fintech or other startups, right? Uh, we are touching human lives, and there can be potential unintended consequences, either by omission or by commission, right? So there needs to be additional level of trust. So it's worthwhile to go through additional year or two to create the evidence.
Mm-hmm.
So, for example, the technology we spinned off, the remote monitoring platform called Health Promise, it was NIH-sponsored trial, 2 years randomized controlled trial. We showed the value in that, and then it got spinned off. The same with the platform. We were able to increase activation of the patients from 6%. If you just tell a person to download an app, just in conversation, like you and I. But if I'm a physician, I prescribe you an app that lands on your phone, we were able to increase activation to 92% with a system usability of 94 percentile, right?
So
So,
that is huge. I mean,
mhm,
that is just really huge because, I forget what the last count is, but it's like somewhere around 50, 100,000 healthcare apps on the market. And most of them are like crickets and cobwebs, right? There's
mhm,
nothing going on in there. And that doesn't mean that it wasn't a viable tool. So not only do you have to sell the innovation, but then once it's sold, you've kind of got to have this strategy for adoption. So yeah, just speak to that a little bit more. I think
sure.
that's
So,
huge.
yeah, so we hit a kind of a roadblock 3 years ago because a lot of the stuff we were doing were building apps, and that was fairly successful in research setting. And they were successful because the research coordinator was able to walk the patient, kind of handhold the patient. But if you really want a scalable transformation, you cannot have a research coordinator or any
Right,
coordinator because
right.
that's not time efficient, right? So 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 then we did a time motion analysis, and we saw patients, if we recommend them an app in the routine conversation like you and I, patients will forget the name, they will mistype the
Hmm.
name. Even if they get the right name, there are more than 350,000 apps, so they forget the activation code and which is the right app.
Sure.
So we knew there were actual customer friction factors for them to get into the app. And here we were building all these assets and apps, and but no one is using them because there was no platform to deliver it to the right patients. So that led to our 1 or 2 years effort just completely building a platform to deliver apps to patients. Initially, we started out delivering one to one, like patient comes, to us in a clinic. We prescribe an app, they get onboarded. We found 92% engagement rate with very high usability.
Wow.
When we spinned off to Rx.Health, they built a platform for bulk prescribing where they can prescribe to thousands of patients at once. And they did that for Yale New Haven, where they were able to prescribe 25,000 people MyChart app and got 10 to 15% patients converted into MyChart. Uh, and
Wow.
that led to what 8 people would have taken a year to do, were able to do in 2 days using this capability. Now using API and Fire-based engines, we can actually auto-prescribe apps where if the patient new code of asthma gets dropped and there's an asthma app, it automatically gets dropped, prescribed to the patient without a human touch. So I think a lot of the journey has been making it so easy to reduce any burden on the physicians because EHR have
Mm-hmm.
already created enough burden. Our goal is with digital medicine to create it in such a way that it is in a way invisible. The magic happens behind the scene. The patients get engaged. The patients come at the appointment, but physicians don't even have to click on anything, and they get the benefit. I think
Mm-hmm.
we as a provider community, as a care community, deserves a technology which actually works for us rather than against
Sure.
us.
Yeah. Yep. Absolutely. So, how has pharma responded to this idea of prescribing apps?
So it has been actually we have a lot of collaborations with pharma now.
Mm-hmm.
Um, internally at Sana App Lab, but Rx.Health also, they made an announcement that they have a partnership now with 5 years with Roche around IBD to create a national network of 10,000 patients who will
Mm-hmm.
be on the app and the data will come back, right? Connecting with
Wonderful.
IBD
Yep.
centers.
Mm-hmm.
And Roche wants to take it to Europe and many other countries as well. So I think pharma is looking for solutions to meaningfully engage the patients. They're not very different than health systems.
Mm-hmm.
Even payers want to meaningfully engage with the patients,
Sure.
uh, right? They all come with a slightly different perspective. But if you have a platform approach, it's the same thing which pharma wants to do, a certain set of things which health systems wants to do,
Mm-hmm.
right? So you find common grounds, and pharma can sometimes fund those endeavors which health systems may not have bandwidth to fund.
Yep, absolutely. So is it open source or open innovation where if somebody has an app, they for a patient, how do they get access to the RX platform so that way their app can be prescribed?
Yeah. So I think it's a curation platform between Rx.Health. So first, anyone who's an app vendor can actually just say, "Hey, we're building this," and there's a very simple online process, onboarding process, where they just have to show is it evidence based or not,
Okay.
right? And
Mm-hmm.
so there's a curation process. So many apps get blocked if they're not of high quality, they do not have the right clinical content, or they do not have the right API for interfaces, right? But if they're the right technologies, whether it's an app, whether it is a shared decision making video, whether it is a wearable device, or Internet of Things, any of those things, as far as it's validated and it's a value driven thing, it's an open API which RX Health has and that will open it, so it can be prescribed.
Okay.
So it becomes
One.
a marketplace in that regard.
Yeah. So you had touched on, this innovation that you were developing in 2005, and now it's 2019. So you've kind of been at this for a while. And if you think about, where the industry was in 2005 and then where we are today, man, a lot of people, there's still a lot of change that needs to take place, but in some regards, we've come a long way. Um, so, what are the challenges that you think that health innovators are still facing today or that are facing in 2019?
A lot of challenges, I think. Still, I think the biggest asset has been technology, right? So what our programming team used to take 9 months to build an app, now we can build that within a week,
Mm,
right? It's just been amazing from a data science perspective. All the algorithms had to be written yourself for neural networks, and now those are all packaged stuff, and you can just run those models, right? So I think
yep.
that efficiency has been created. I think efficiency has not been created in adoption in health systems,
Mm-hmm.
right? So those process challenges, those people challenges actually remain, and in fact, they may be worse now because there's so much technology now that we may be creating barriers of adoption because which horse to bet on. becomes a problem for the
Sure.
health systems as well. Um, I think also, I think because technology has become, I would say, a little bit a commodity, uh, it is easier to build things, but it is tougher to distinguish and create something novel,
Mm.
right? So people say, hey, this is great, this is fascinating, but not many novel things come which are
Mm-hmm.
value driven as well. So I think part of still the challenge is to create novel things, not just what is the platforms which are built on top of that, but truly unique solutions and truly which can be game changers, even
Mm-hmm.
if it's a narrowed vertical.
Yep. Absolutely. So what do you think is the biggest driver of success? If you had one lesson that you've learned in this whole process, kind of speaking directly to our audience who are in the trenches right now, what are some lessons, or at least one thing that you would recommend to them?
I think it's believing in yourself and your team and having resilience. It does come to core human principles, right? The barriers will always be there. They've been there, anything that mankind has done, right? Any scientist does anything, for researchers, for clinicians, right? For it's the same for innovators as well. But truly, if you believe you want to create value, right? And you believe the path is the right, like you're on the right track,
Mm-hmm.
just having resilience allows you to take all those barriers, all those challenges in a very neutral manner, because everything is positive. If you are in the right direction, the barriers will just change the speed of how fast you can run.
Mm-hmm.
But the direction you decide, right?
Yeah.
And if the direction is right, then you're gonna reach there where you want to be. And think that so it's, I think I've learned a lot. It's as a physician, we do things, we nearly always have success, right? So I see patients, they get better. If they don't get better, we always know why they didn't get better, right? In a
Mm-hmm.
startup or innovation, it's not like that.
Right.
Things are never done before, so you don't even know you're on the right path or not. So you can't just base on external things always you're right or wrong. You have to have internal parameter as well, and your team, which becomes your multiplier factor in that regard.
Mm-hmm. Yeah, absolutely. Well, this has been a very valuable conversation. I thank you so much for the wisdom that you've shared with our audience. I know that they have learned a lot from you today. And so, as we wrap up here, what is the best way for people to get a hold of you if they have some questions for you and they want to just kind of follow what you're doing?
Sure. I think Twitter is easy, at Atreja, Atreja, is a very easy way to get hold of me. They can also get hold of me through App Lab. There's a contact. So if you just go to applab.nyc, they'll be able to get a contact form and get hold of me, or LinkedIn. I'm the one wearing a bow tie. They can find me and just connect with me.
Love the
I'm
branding
happy
of
to.
the bow tie. Brilliant. All right. Well, thank you so much.
Wonderful. Thank you so much. It's a pleasure.
Bye-bye.
Great.
What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization, and to watch past episodes of the show, head to our video show page at drroxy.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search COIQ with Dr. Roxy. Until next time, let's raise our COIQ.